Good morning, everyone, and welcome to today's conversation. We are privileged to have Mrs. Khumo Shopo and soon to be Dr. Khumo Shopo, and we are so proud with you and glad for your sake. Khumo is someone who really practices presence, and I'm glad to have her here today. So good morning, Khumo, and thank you for being here and welcome. Please introduce yourself.
Good morning, Prof, and thank you for inviting me to this platform. My name, like you said, is Khumo Shopo. I was born in a very small town called Zirast, around in the northwest here. And I'm a lecturer, I'm a nurse educator, and I am a mother of boys. And I think pro-presence, if I may say that, because it's one of the characteristics or aspects that really brings out the therapeutic interaction when you are interacting with other people. Some of us, we are doing that, we are being present without even knowing it. I was just surprised when we said I'm practicing presence now, because at times you are not aware of it, but it's something that is inborn, that is within you, and other people would realize or notice that more than you are aware of it yourself.
Definitely.
So that's yeah, that's me.
Thank you.
And yes, I am a PhD candidate, hoping to finish by this year. And I'm working on cultural competence. It's one of the other aspects that I'm looking at.
Okay, thank you very much. Would you like to tell us a bit more about the cultural competence?
Okay, cultural competence. My focus is on the midwifery, but cultural competence is also one of the concepts or terms that are in nursing that have been there, but they are not that much researched, especially in South Africa. When you look at the international trends, the cultural competence has been integrated in nursing education, in midwifery, or in other aspects of healthcare, like the mental health and all that. But within our context, I can say it's at baby stages, because when you look at our policies or our guidelines from the national government, cultural competence is not integrated that much, even in education. So when you talk about cultural competence, the most prominent definition would be for someone, a nurse, a healthcare practitioner, to acknowledge, embrace, and incorporate the cultural diversities or the cultural aspects of the patients that you are interacting with. So not only saying, yes, I know that the person is a Motswana, they behave like this, because even within the different cultural groups, we might not practice the same way. So it's very much important for a nurse to be in tune with the different cultures, so that when you approach a patient, you also know that if I do this, or if I look at the patient like this, they won't like it, because in their culture, like with some of the Nguni tribes, you don't look at the elderly in the eye. So it's somehow interpreted as disrespect. But with the others culture, like from the Western cultures, the whites, they want you to look them in the eye, because for them it says you are fair, you are straight, you are honest. So the perceptions is not different from various cultures. So that's my interest. My interest especially is in the context of midwifery, because our patients, especially the African, are still rooted in their cultures, most of them. And when they consult at antenatal or in labor or wherever in terms of the maternal care, they still use their cultural practices, the beliefs and the values. They still do that. However, in practice, we are trained to do things in a Western manner. And they come with their African perspective, and those two worlds clash. You find patients saying they didn't treat me well, but from the nurses or the midwife's perspective, they think they did well because they did according to how they were taught. And the patient expects to be treated according to their own cultural beliefs and practices. So there is a clash of two worldviews, if I may say it like that, in terms of our practice and the patient's beliefs.
Yes, that's such a close link with presence.
Yeah, it's very much in tune with the presence, because once you acknowledge the patient's cultural practices and their beliefs, and you attend to them in tune with that, it shows some kind of you being there with the patient, being with the patient, I mean, acknowledging the patient and really walking the path with the patient.
Yes, so all of the best with your study. And saying that, what is your view on presence?
My view on presence is that it's a consequence of the interaction between the nurse or the healthcare provider and the patient. That interaction must be genuine. That interaction must, in a way, contribute towards the healing or the assisting the patient to heal. It doesn't work on its own. But if you practice presence while you are doing your nursing duties, then that contributes. That's why I'm saying it's a consequence of that interaction between what you do as a nurse and how you do it to the patient or with the patient.
Yeah, I so agree with you.
That's my view on presence.
Thank you for sharing that, because I so agree with you what you are saying about that it cannot be separated from what you are doing and from the interaction. So it's part and of how you are and who you are, but it's also part of what you do in interacting with the patient.
Mm, mm, mm.
Can you give us
Definitely.
Can you give us some examples of perhaps a presence that you saw in practice or perhaps experienced?
Okay. I'm going to give you a few. I think I'll just stop where I feel like it's enough. The first time, because the term presence is, it seems like it's a new thing because now it's being researched. But I think the time when I came across that in practice was when I was still in clinical. I was working in one of the clinics in Klerksdorp, and with maternity, I have passion for midwifery for maternity. So I used to work mainly on that section, and you'd meet patients who are difficult, patients who, when they are in pain, they are very uncooperative. But there was this particular patient that I was having on the day. She was very difficult, but I didn't take to heart what she was saying because she was not very friendly, if I may put it like that. She was harsh, she was, swearing, but I kept with her and I just kept explaining the period that the baby comes out. Just bear with us. I kept checking on her. Just when she starts screaming, I was with her. And then I tried to motivate her to do the right things, breathe and all those things, because there was no one who was accompanying her. So throughout the day, I kept doing that with her and just trying to calm her down whenever she was starting to scream, because there were other patients in the section. And at the end of the day, she gave birth to a beautiful baby, alive and well, even though I struggled. But one thing that made me feel gratitude at the end of that, she said to me, "Thank you very much, sister. I know I have been very difficult, but we persevered." And she said, "Thank you." And that made one feel gratitude that what you've been doing, that swearing and all that you went through for that 6 or 8 hours during the day, she recognized that. She felt that, you know what, I have been bad towards this lady, but she persevered, and here I'm holding a very beautiful, healthy, alive baby. And she was thankful. So that's one experience that I've had from myself. The other experience is in 2016 when you invited us, Prof, to do the research with you, because on the presence, and we went to Khanyisa and Taung and all those areas. I really saw those nurses, they are practicing presence. They are also not aware that is presence, what they are doing with the patients, but they are practicing it. They are working in an environment that is there's shortage of staff, resources are very limited in a rural area and with a high number of patients, but they are doing it. And the stories that they were telling us, I remember there was one nurse who was, I think he was working in a psychiatric unit. And he said to me, you know what, at times I meet these patients that we had in the ward, and they are outside. And those patients still remember me because he's in the village. And he said, those patients still remember me and they still come up to me when we're in the village, either in the taxi or somewhere, and they say, Chajo, because the male nurses are called Chajo, Chaj or Chajo. And he said, the patients will come to me and say, Chajo, do you still remember me? You know, you helped me. Look at me now. I'm no longer in the hospital in isolation or seclusion rooms, because some of them have these substance problems and all those mental problems that need for them to be secluded. And he said, you know what, the only time that I feel happy is when I see those patients out there taking care of themselves and telling me that you remember that you nursed me. So there is a consequence of presence in our interaction with the patients.
Yes,
there's many more, but I'm going to take up a lot of your time. So those are the two things that stand out for me in terms of presence. And the other one, which is more, if I can say personal, was the last, I gave birth to a boy almost last year, you remember, Prof?
Yes.
And I was in the maternity unit. This nurse, that the midwife who was assisting me, she really practiced presence. But I also think she's not aware that she practiced presence with me. And the one thing that made me feel comforted and really felt her presence was one of the times when I had contractions and she came up to me and she rubbed my back. She just spoke to me, we were just talking, and then she started, when I started having the pains, and then she would massage my back like that because I was lying on the side, and she would massage me. And I was so thankful for that. And I told her, you know what, thank you. I haven't had a nurse massage me before, but she is doing it, and I didn't ask her to do it, but she did that. And after that, she sat down, she was completing the photograph. She sat down with me and she chatted with me until the next contraction again, and she just came to me. I think 2 or 3 times she rubbed my back, and I was content that I'm in good hands with that midwife. So there was another experience of presence for me.
That's a wonderful experience that you, from your side as a patient, experienced the nurse being with you and sensing your needs and knowing what to do in that moment.
Very much, very much.
Thank you so much for sharing your examples, all the examples that you shared. I agree that I also think that that is presence. Thank you for that. I wondered if you have a word of encouragement for nurses, please.
For the nurses, I think the nurses, especially in our country, are the backbone of the health system. They are doing an incredible job, as much as it doesn't come out often to say to them, you are doing a great job. But I feel that the nurses in the country are really sticking it out and they are giving it their all. You'd find negative comments or negative statements either in social media when there's one incident of something that happened that is bad. That type of things sort of clouds the good that the nurses in the country are doing. And I think we as nurses, although we are faced with those challenges of trying to make out, trying to do what is best for the patients within the very difficult circumstances, we should pat ourselves on the back, and not everyone can do. No matter how difficult, at times you find as I was doing my data collection, I was doing it in 5 of the hospitals in the province. And I really evidenced or experienced what the nurses are going through on a daily basis. The maternity ward would be full and there would be 6 midwives. And maternity patients need extra care. Not to say that the other patients don't need it, but it's a person who is bringing another life. So they need extra care, but those nurses would be dividing themselves among 28 patients, which is the patients are not going to get 100% quality of what they expect. Because as much as the nurse knows that I must give health education, I must discharge correctly, I must do this, I must do this. At that same time, there's another patient who comes in who has to be attended to. So the conditions that the nurses in the country are finding themselves within, they still push through. They still make it. At some stage, there was, when I went into another ward, they didn't have enough beds. The poor patients were sitting on the chairs. I'm talking about now patients who are in the early stages of labor were sitting on the beds, and I looked at the nurses running around trying to get space, to an extent of trying to get space at another ward outside of maternity, just to accommodate those patients. So the nurses in our country, I'd like to say to them, I applaud them for doing the best they can with the little that they have. Regardless of the negative publicity, at times there are things that you cannot control. And at times it's a mistake that the nurse didn't intend to happen, but it happened. So not to say I condone the carelessness, but the nurses are doing their best. So my message to the nurses out there in the country is that, especially at this time where we are facing this pandemic, which we are all fearful of, but they are out there bracing it and giving it their all. So please take care of yourselves, take care of your families, be there for one another. I know that this pandemic is affecting all of us, but nurses still push. Although at times you'll find them having placards in some hospitals because there's no PPE. Yes, it's their right to say, as much as I have to help the patient, but I have to be safe as well. So if all the nurses had to contract COVID-19, who is going to attend to those patients who are ill? So yeah, it's a very delicate situation that the nurses find themselves in at the moment. But I would like to encourage them to say, give it your all. And one of the good days we'll look back and say, shush, did we go through that? But unfortunately, there are those of us who some of the colleagues who have lost their lives to this pandemic, and may their souls rest in peace. But for those who are still standing, go on.
Thank you so very much for that encouraging message. I'm sure that it will make a difference. Thank you for that.
Thank you, Prof.
And keep well, Khumo. All of the best with your studies, and thank you for being here today.
Thank you, Prof. And you keep well too.
Thank you very much. Bye-bye.
Okay, ma'am.
Bye.
Bye, Prof.